Started, like, I'd say around 7, 8 is when we really noticed. Our biggest thing was the emotional outbursts that he was having, and he wouldn't be able to comprehend what we were saying. It was like he just was very upset when we were trying to talk to him. In school, he wasn't having good relationships. He was that child, and there was lots of problems there. He spent a lot of time in the office and a lot of time in the hallway or away from other adults and that, because they said that he was disruptive, couldn't control himself, too fidgety. We were about a week away from putting him on the Ritalin, and Ellen and I, we were struggling so much with this. Like, we did not want to do it. I personally had done so much research and seen how it can affect children, and the not being able to sleep, the lack of appetite, the lethargic. I've heard that some children's moods change. It devastates me to think of all these horrible side effects. And now it's totally new. He's doing so well in school. His grades have come up. He's able to concentrate. He will have fun in school, and he's engaging now. If we go, we can ask him to do a task, and he will actually complete the task rather than forgetting the task. So it's been a lot of changes as far as focus and reality. He's a completely different child, and I love it. It's a much better, happier moment for all of us. The biggest thing that Riley couldn't do from before that he can do now is concentrate and have those conversations, the interactions that he couldn't have before. So when he was sitting at the table and having to do schoolwork for that first half hour, before we would never have been able to do that. It would have been impossible. Every 5 minutes he would have been getting up. He would have made every excuse in the world to not sit down. There wasn't the tears, there wasn't the have to do this, have to do that. So our biggest change has been with that. And socially too, he's making friends where before he wasn't. Now he's interacting in class. The teachers love him. They want him in the classroom. Whew, I love that part. And funding needs to be given for healthcare costs, so that, if you are on a medical plan, that your pills are covered. It's such an important piece to our lives, at least. And I think that the medical community should understand it. It's going to be a game changer. I would literally tell my doctor that he needs to look at my son. He needs to look at the children who have done this. But my son is a Class A example, because it is literally night and day. It was life-changing. Now we can look back, and it's like, now he's happy. We're all on the same page. We're laughing together. We're having a good time. I feel that he is going to be able to go farther now. I think that just because he's able to concentrate and he's able to have that social interaction, he's be able to articulate how he feels. So that all combined, I feel that he's actually going to be able to use those skills now to go where he wants to go.